If labor trafficking or exploitation is of concern, a trauma-informed, survivor-centered approach is crucial. The principles of trauma-informed care are safety, choice, collaboration, trust, and empowerment, where providers help individuals activate and use their own power. By understanding the effects of trauma and practicing in a trauma-informed way, you will reduce the risk of re-traumatization, provide the best care for your patient, and facilitate healing. We encourage you to seek further training on trauma-informed care.
I know you work in a fast-paced environment, but if you see that someone is a possible victim of trafficking, especially if they're a child like I was, be gentle with me and just give me a reason to trust you.
Providers should respect a patient's decision on accepting help, except in the case where mandated reporting is required. It is important to honor the patient's decision to decline help while assuring the patient that the help will be available for them should they choose to seek it at a later time. It is also important to understand that disclosure takes time, especially if there is fear of financial or legal repercussions, such as deportation, that will affect a patient or their family.
Nobody's going to just show up and tell their healthcare provider or their lawyer that they've been trafficked. They probably don't know what trafficking is, especially because there are a lot of misconceptions of trafficking. They might just think the only form of trafficking is sex trafficking, and so forth. So the chances are they're not going to identify it, and chances are healthcare providers cannot absolutely determine that a situation is trafficking because of lack of time. It's not really what the person's there for. They're there for their healthcare need. So what's really key is noticing red flags and making referrals if that's what the patient wants. And with trafficking, it's kind of like domestic violence in that it might take a while for the individual to decide to get out of the situation.
Follow-up appointments and communications as deemed feasible by the patient can help foster this and allow more opportunities for preventative education, including discussion of labor laws and worker rights.
We're going to establish where are the secure lines of communication. Do they have a secure cell phone? Are there private phone numbers or ways that we can reach them through the phone? Do they have secure emergency contact folks that we can connect with so that we can reach them? You want to establish your therapeutic alliance and build trust with the patient so that they do want to come back to see you. You can't force them. You can't force them to come back, but you can always make sure that they know how they can reach you.
Being able to educate that individual and redirect their focus more on what their workers' rights look like, and even just showing examples of what a healthy environment looks like. We can give the resources on law, we can give resources on personal protective equipment, but if we're not showing models, just quick models on what a healthy workplace looks like in the United States, it may be difficult to make that connection.
Ensuring the safety of your patient is crucial. This involves thoroughly assessing the health and safety risk associated with the patient's current situation and identifying harm reduction strategies that can be immediately implemented, as well as developing specific plans for possible unsafe scenarios that may arise in the future. Safety planning should also include a discussion of whether the patient would like law enforcement to be involved.
Especially with the marginalized populations I work with, I don't push for more law enforcement than needs to be, or that will dishearten them or further put them at risk.
Connecting a patient with resources is crucial to providing an appropriate response. It is important to identify a patient's specific needs and discuss how they would like to proceed with assistance.
If someone has said that they do want to leave a situation or they do want help out of a situation, they're the experts in their situation. Of course, they might not know their rights, and that's where you can come in as an expert to help them with that and give them those tools, and letting them know, no, there are certain places you can go, but I would at least have that relationship built, have those networks built before making promises.
Offering your patient the option to have a family member or loved one accompany them for additional support is essential. Labor exploitation and trafficking are complex medical, legal, and social issues, and an appropriate response is multidisciplinary. A response may include psychiatric or mental health services, shelter or housing, food services, clothing donations, legal assistance such as civil, immigration, and criminal legal aid, transportation, addiction treatment, workforce development, survivor support groups or mentorship, and social services.
As a healthcare provider and taking care of their immediate physical and mental health needs, you want to assess that as you do normally as a physician or a healthcare professional, assessing what their physical needs are. Do they need mental health interventions at this time, or behavioral health interventions and support at this time? What are their immediate concrete physical needs? Do they need shelter? Do they need food? Where are their documentation? So it's not different from what we do for our patients that we see. We're assessing for what they need. Center the patient, center their needs, make sure that they are aware of what's going on, and connect them to resources.
What I will broadly say first is being able to build a rapport outside of their work conditions or what brought them into the healthcare facility, I think may help soften the approach, and it may help that patient understand that, for them to be in that healthcare facility, it's not their fault necessarily, right? Like they should not be blamed for wanting to come in, or they shouldn't feel ashamed of, I think that's a better term. They shouldn't feel ashamed for coming into the healthcare facility.
Federal law does not currently require reporting of suspected human trafficking of patients 18 and over. However, each state differs. Please check your state's mandatory reporting laws. If a patient is under 18, all providers are mandated reporters for any suspected abuse, whether trafficking is a concern or not.
If you are concerned about labor exploitation for a patient and there is no mandated reporting, I think you really want to do that universal education for your patient. What does the patient want? What do they need, right? Do they want to be out of that situation? Do they want more support so that they can have the proper working conditions? Are they looking for different work? Are they able to leave that work? So I think it's really talking more extensively with the patient about what they need and what they want.
You can access the National Human Trafficking Hotline by calling 1-888-3737-888 or texting HELP to 233-733 or be free. This resource will answer providers' questions and offer guidance when trafficking is suspected. More importantly, it provides local and national resources for patients, including shelters, legal agencies, and mental health resources. Patients are able to access this independently.
If back then the service providers that were around just asked me what I wanted, I probably would have told them I wanted to go back home. I wanted to reunite with my family because I was a child.